upgoing curve, as you can see. And Emirates, I think, is almost going to follow the same rate if no prevention programs, or if no programs has been focused on those pre-diabetic patients done immediately to really stop the invasion of this big medical problem to the Gulf states. Now, to convince you more, this is our data from what is going to be published maybe in a few weeks or months from now. This is our big national diabetes study, and this shows you the different risk factors. Look at the prevalence of diabetes in men and women with age, and you can see that we are speaking about 1/4 of the population who are older than 30 are by definition now diabetic. And unfortunately, another 1/4 who are also in the same age group are pre-diabetic or impaired glucose tolerant. This is using the new criteria and using fasting blood sugar. The other very interesting point is this, what you can see for the impaired glucose tolerance, which is the pre-diabetic phase. Look at this, there is no age preference here, which is somehow very strange. And I can tell you that this is because of the change in our lifestyle and the invasion of another big risk factor, which is the obesity. And this is why we are seeing impaired glucose tolerance in women and men, regardless of their age pattern, which is something telling us that this problem is going to grow and grow even in the future if nothing has been done. This is only a regression analysis looking into the odds ratio and relative risk values, trying to come up with the major risk factors for both diabetes in the top here and impaired glucose tolerance in the bottom. I just want you to know that the risk factors for diabetes is mainly age, hypertension, previous history of gestational diabetes, and hyperlipidemia, mainly hypertriglyceridemia. And as you can see, that they have really exceeded 2. While the other risk factors, which are really considered in the Caucasian population more important, is less important in our situation. I think this is, again, for different reasons, which I'm going to really allude into. Now, if you separate diabetic patients and look into the pre-diabetic population, then you are really going to be exposed, you will be exposed to another risk groups. Previous history of gestational diabetes, dyslipidemia, obesity, high triglyceride, and big babies, and